morning, everyone. If it's still morning where you're located, my name is Elizabeth Tisch, and we're very pleased to welcome you to our January webinar hosted by the E-Extension Financial Security for All community. And today we'll be talking about the value of Family and Consumer Sciences Extension in the North Central region, although we do feel that it probably translates into the other regions as well to some extent. I'd like to welcome our speakers today, Deb Gebicki, who is an Assistant Director, Family and Consumer Sciences from North Dakota State University Extension Service, and Paula Peters, also Assistant Director at my institution, Kansas State University Research and Extension. And both of them have been program leaders for several years. Deb has her degrees from North Dakota State University and also the University of North Dakota. Paula has her degrees actually from South Dakota State University and the Ohio State University for her PhD. And both of them, as well as Karen Bruns from Ohio State University, were involved with the leadership with the other program leaders in the North Central region for working on this study that they're going to be telling us about. A few nuts and bolts for our webinar today. We are doing interaction via the chat box, so feel free to type your questions in the chat box, and we will be monitoring that. And the webinar is being recorded right now. And before anyone asks, the PowerPoint slides will be available via the Learn page, as will the link to the recording of the webinar. So I think that's pretty much all of the nuts and bolts. And with that, I'd like to welcome our speakers and have them go ahead and share the information that we're all very interested in learning about.
Thank you, Elizabeth. This is Paula Peters from Kansas State University, and we're really happy to be sharing and glad that you invited us to share this information. We're excited about the study, and I think you'll find some nuggets in here that will be very appropriate for all of us to hear. And Deb is going to be starting off our conversation today. So, Deb, go ahead.
Deb, we're not hearing you.
Okay, now can you hear me?
Yes, we can.
Okay, sorry about that. I forgot to take it off of mute. Isn't that great? Okay, we'll start again. The best place to begin is to go back to why we did this study in the first place and how this came to be. The original discussions that took place amongst the 12 program leaders in the North Central region were reviewing how a few years back there had been a study done by the Battelle Institute in agriculture. We also know that very often the TOUGH study and others are referred to for the 4-H youth development programming very commonly. We just felt that, we had not had an opportunity to do a real intensive look at family consumer sciences. And so therefore, we wanted to do that. And we wanted to build upon the questions that we seem to be asked most of the time, and that is really, what is the value of FCS? Why do we have FCS? And if you really define the word value, you will see that it means importance or benefit, worth, usefulness. Those are all questions we were asking, and we were wanting to have some definitive reported information that we could rely on to come back to and cite the value, not only financial value, which is what most people take a look at, but we wanted to go beyond that, the significance and the usefulness, the importance of FCS programming. So we took it upon ourselves to have several conversations with our directors, and we were pleased that our directors would be willing to fund this particular study. And just so that everyone knows, this was a very major investment from our directors in these states. We are very grateful to the directors for doing that. This was a $90,000 study, so this is not something any of us could have done on our own, and it was rather intense. And the reason we decided to stay with the Battelle Institute is because they had done the previous one in agriculture. They are internationally known. but they also clearly were not familiar with FCS. And having someone who was not familiar with us, not typically doing this kind of an assessment of our organization, we thought would work to our advantage. If we could work with someone who was completely impartial, neutral, we thought that was important as well. So that's how we went about with beginning our effort. Why do we want to study the value? First of all, we felt it was absolutely the right time for us to understand the science of prevention, education, and how it relates to intervention and the service sector. We wanted to define the discipline of family consumer sciences, absolutely examine the value, and as I guess our bottom line is make sure that FCS was in position for anything that might come down the way in terms of the Health Extension Initiative. I am going to assume that all of you have had an opportunity to see the white paper that was released in March of 2014. It was put together by a team of people that ECOP asked or commissioned. And that particular paper really was an opportunity for us to say, okay, if we could really do what that paper concluded, and that is, in the next 100 years, do for the health and wellness of Americans what agricultural programming and extension has done in the ag field during the first 100 years of extension, then we need to really examine FCS, and we need to really figure out where are our strengths and how can we best be positioned to accomplish those bold goals. And that was another goal of this particular study. The first thing we set out to do was to take a look at some of the theory that is behind FCS work and prevention work. And we found it interesting because the people who were working with us from Battelle truly had no knowledge of what we did, and they too were asking questions such as, well, how are you different from other social service type of programs and so forth? The typical questions we often get. And we knew that we had to find the best, simplest yet thorough way of explaining that to those who don't know about us. We chose the social ecological model as the method for us to do that. If you take a look at this model, it would apply to other extension programming as well. The bottom line is that in extension, we tend to target the individual or the family, those first two layers of the social ecological model. Our social services agencies who do the direct intervention target some of the other layers, our public policy, of course, in the outside layer. We wanted to make sure that we had a model that we could take and we could explain to those who didn't understand how we collaborate, how we work together, how this would work. And I don't have enough time to go into the whole thing today. I am sure that I'm speaking to an audience that is very familiar with this model, but I'll just give you one quick thing you can do right now that we have done with groups. And that is to say, consider the most successful program that you've been a part of in the last year. Which ring would it fit in? And now consider if you were in another category, let's say you're the ag agent or an ag specialist, and you consider the most successful program you've been a part of in the last year, which ring would it fit? And when we took and surveyed, there were, I think it was 191 programs that were submitted by all 12 states that had solid evaluation impact information. We took those 191 programs, we really took a close look at them, placed them within these circles, so to speak. 81 were at the individual and 12 were at the relationship. Excuse me, it was a total of 107 programs we analyzed. 81 at the individual, 12 at the relationship level. So clearly, the vast majority, 93 of what we were doing in extension and had good evaluation results for, were at those first two layers. We certainly have programs that are at the community level, and we certainly have more and more emerging programs that are at the outer rings, but the problem is that we don't always have solid impact data for all of these. And we wanted to make sure that we had a way of tracking that to help us to do a better job with evaluations, but also as a model that helps us to explain to others what we do and why we do it and how we work together. And then, of course, we went into the prevention science. And this is just one slide that will help to explain the work that we do in Extension versus other work that is more into the social service sector. We have several other things in our report that we think will help us to be able to dig a little bit deeper into prevention work. And it was the Patel Institute that asked us to explain how we differ that led us to this whole summary of the science of prevention work, which is typically where more of our programming takes place. So we'll just give you a little taste of that here, and you can see and learn a lot more in the full summary of our report. The bottom line is that there are several quotes in the report that we come back to. This is one of them that, we really know that investing now will save us money later. And that's not just from a pure economic standpoint, as this quote says, but in human costs as well. And so we really felt that it was important for us to lay the groundwork, document the science behind it all, and that's the initial part of our report. As we did that, we had one other big challenge, and that is just the terminology that we use. I can't begin to tell you how long it took us to just decipher the terminology. And sometimes that's wonderful because we make it work in our local states and our local counties, and sometimes it works against us because it sounds like we're not all working in sync. Even the discipline of family consumer sciences, which is how we chose to label it in the report because it was still the majority, but barely a majority, who were using that amongst the 12 states. The next closest was human sciences. So very often now when we do our presentations, we'll say family consumer sciences or human sciences. We have so many different names across only our 12 states, much less across the nation, that makes it sometimes a challenge for us. We then took all of those programs that I mentioned that we wanted people to submit, that those 107, as we analyzed them, that had good data behind them, and tried to put them into categories. These are the 3 categories we came up with. We also used names that were most commonly used again, but there are a lot of variation amongst our states with the terms that we use. And then, of course, we have a couple of states that still have programming. For example, Michigan still has a housing program, but very few other states do. We did not include it if it wasn't something that the majority of the states were using. So we narrowed down the discipline of family consumer sciences to include these 3 areas. We dug into these 3 areas with a full analysis and tried to do some much more in-depth analysis of the impact data that we had to lead us to the findings. What is the value of FCS programming? And that is where Paul is going to take over and tell you about our findings.
Thanks, Deb, and I'm glad to be able to share some of the findings. As you might imagine, as we began to do this work and uncover all of the different programs that we're involved in and we narrowed our programs down to 107 from I don't know how many to begin with. And we used the 107 programs that we had impact data for and could report against. So the report itself coming out of Patel is around 120 pages. So I'm not going to be able to present all of the findings that came out of the report, but I'm going to give you some highlights and tease you a little bit and send you off to the full summary report where you can delve into it a little bit deeper. But overall, the key findings were indicated on this slide in general. We, of course, have some substantial economic returns to the North Central region and to the nation. We make positive differences in behaviors and shaping policies. We utilize the most effective educational materials that we can find. We partner with a lot of other entities and leverage our resources to reach people more effectively. We focus on education and prevention, as Deb talked about earlier, which is different from social service agencies. And we utilize frequently the train-the-trainer model to multiply our impact. And I just want to say that all 12 states in the North Central region were a part of this study. So we've got programs from every state in the report, but not every state was involved in all of the programming results that I'm going to be sharing here with you today. And in some states, they didn't even do all of the 3 major program areas that Deb just talked about. So, but in general, what we reported on and what is included in the study are the most common areas that cross over the most states and all the ones that we had measured impacts and outcomes. The key findings here on this slide, though, are consistent from state to state, and they're likely very similar across the country for all of Extension, Family, and Consumer Sciences. But number 1 finding was about economic impact. And as Deb said earlier, that's not our only way of contributing value from our extension programming. And I would add to that, it probably isn't even the most important way that we do that. But it is, when you talk about value, people want to know what kind of financial impact we're having. So these, the bullets on this slide are some of the areas where we could pull some dollar value from our programming. And FNEP, of course, I think you are probably all familiar with the FNEP program, and that we have done some really good benefit analysis of the FNEP program over the years. So we use the data from that research to estimate how much in future healthcare costs we are saving the region, and the amount came up to be, depending on which study you look at, the total for the region came out to be between $86 and $185 million for the 12 states in the region. We also extrapolated information from the FNEP study because SNAP-Ed is so similar in a lot of ways to that, and we did this in a very conservative way. We don't have any evaluation studies that talk about economic impact and future healthcare cost savings for SNAP-Ed yet. But using the data we have from FNEP and actually cutting it in half so that we were sure we're not going to overestimate the value of SNAP-Ed. SNAP-Ed in the North Central region extension programs, using that kind of figure, came out to $185 million each year that we are saving in future healthcare costs. Then seven of the states were doing a program targeting chronic disease self-management, and the estimate there is that for every dollar spent on that program, $4 in healthcare is saved. ServSafe we were doing in most states, 8 states across the region, and that also results in a lot of saving. Each year, the CDC estimates that 48 million Americans suffer from foodborne illness, and the ServSafe program in the North Central region educated more than 6,000 commercial food handlers and kitchen handlers in 2014, the year of the study data, making literally thousands of food outlets in the region safer for consumers. Hard to put a definite dollar value on that. Strengthening Families, many of you are familiar with, that comes out of Iowa. 8 states in our region use this program, and they have done studies that say that $9.60 is saved for every dollar spent on that program. And then, of course, SHIC. Many of you are probably familiar with that, the Senior Health Insurance Counseling Program. We have an estimated savings of $20.69 for every dollar spent in 2014. 2 of our states in the region were doing the SHIC program, and 1 state alone, savings of $3 million in 2014. So economic impact, of course, is important, but not the only thing. As Deb talked about, we looked at more than 100 different programs through this work, and through that evaluation, Battelle shared with us that they saw a lot of behavior change and shaping policy as a result of our programs. And I'm going to talk about a few of them. And when you talk about getting to shaping policy at the local and state and national levels, it does get a little bit more difficult to measure the impact that we're having. But I'm going to talk about some programs that are working toward getting to that outer ring of the social ecological model. And these examples are ones that are being conducted in multiple states in our region. The Voices for Food program is actually a research project in 6 of our states where they're looking at how multiple entities at the local level can work together to ensure that there is an availability of healthy food for limited resource low-income families in rural communities in our programs. And Communities Preventing Childhood Obesity is a 7-state research project working with community coalitions to improve the environment, to decrease the risk for childhood obesity in a preschool age population, also looking at that in low-income rural communities. And you're going to see a pattern here. That is one of the things that is pretty consistent about all of our North Central region states. We do have a large rural population in these states, and oftentimes a large low-income population. So some of the work that we've done, consistent from state to state, is of course related to those populations. And Together We Can is another one of them. It is a community-based program that helps community entities come together to help families and individuals work their way out of poverty. So those are just 3 of examples of where we are working in behavior change and shaping policy. The third finding that came out of the Battelle report has to do with using the most effective educational materials available. We tend to tap into whatever kind of programs we can find as long as they are of high quality, based on solid, sound research, and have evidence that they are effective programs to use. And just a few examples are listed there in those bullets. But we also, if there aren't materials available, or we believe we need something that's more appropriate for our part of the country, we have developed several materials as well. And those, several of them have gotten awards, and I've listed those programs on this slide too. I won't go into detail about those programs, but you can find more information about those also in the report. The next finding from Battelle was that we use partnerships with others to leverage resources and to reach people more effectively. We are a region where we don't have a whole lot of resources in any one state for the most part, so we do a lot of collaborations. We collaborate with other entities in our states, like military or social services or health agencies, but we also collaborate a lot across state lines. I think that's one of the things that I have recognized as being in my role. The North Central states do really well. The program leaders in family consumer sciences, we just work together very well together for a lot of reasons, and one of them I mentioned, we don't always have a lot of resources of our own in each state, so it's pretty important for us to work across state lines. But we really like each other a lot, I think, and have pulled together some programs that are cross-cutting, including the ones that are listed on this slide. Each of the regions has a nutrition education center for excellence that is targeting research that supports both our AFNEP and SNAP-Ed programs. What's different about the North Central one is that all 12 states pulled together to submit one project, which was funded, and we're jointly collaborating around. And I've already talked about the next one, Communities Preventing Childhood Obesity and the Voices for Food. But there is another research project addressing obesity in middle school youth that collaborated with 3 states to receive funding from the AFRI funding source. So we're really good at that, I think. And then the next bullet, we focus on education and prevention, which is different from social service agencies. And for this bullet alone, I could probably have 10 or 15 slides. So I decided to focus on the family resource management part of the report, thinking that might be the most interesting to you. But the bullets on this slide show where we are working in more than one state in several areas. The savings programs, 9 of our states are doing some kind of savings program. Transfer of personal property, including farm succession, is being done in 6 of our states. Home buying and foreclosure in 3. Together We Can, which is a program that I talked about earlier about poverty, in 3 states. Volunteer income tax programming in 4, and money mentoring program in 5. One, though, I do want to add, as we're talking about this, though, that there was a couple of opportunities that Battelle identified, as well as key findings, and the opportunities related to how we could do a better job of being able to tell our story if we did more parallel efforts in programming across state lines. And these programs do that, but not all of our programs did. And it was really difficult for them to pull things together, because we may each be doing a program related to something that's happening in another state, but it was really hard to bring the information together. And their recommendation was for us to do more parallel efforts in programming and to do more standardization in our evaluation and reporting of the impact that we're making. It would help us better understand our effectiveness and be better able to share the impact that we're having. And I would guess that that is true across the country. It's not just in the North Central region. But it is something that we in the North Central region are planning to work on in the next short time. We're organizing a meeting where we bring quite a few of our state specialists together so that we can see how we can make some progress in that regard. And then finally, the last bullet about key impacts has to do with multiplying the impact. And we do that in a lot of ways, especially with training others to extend our reach. So we utilize a train-the-trainer approach. And you're probably familiar with some of the master programs that we do, including Master Food Volunteers, Master Food Preserver, and Master Money Mentors. But we also do quite a lot of training of other professionals. And I would say that's true in each of the 3 major programming areas. We work with other professionals like child care providers and center directors, teachers, and health professionals to help them be better able to reach the needs of families within our states. So let's come back to a reason that Deb talked earlier about doing the study in the first place. And one of them was to prepare us, position family consumer sciences for the future. And the future right now is in the health arena. And if you're not familiar with the national framework for health and wellness, here is a picture of it, and there's a whole lot more information about it in the white paper that Deb talked about earlier. And I know that some of you are very involved in the extension work with regard to health and wellness, and are on some of the subcommittees that we have developed an extension to help us identify how we're going to work in this arena over the next several years. So in each of these different items in the orange part of this circle, we have committees that are pulling together plans for helping guide extension work for the next many years with regard to health. And we hope that this project and the report that came out of the Battelle study will help as you are working on those committees and provide some valuable input into at least identifying how we are currently working in these various areas. And then I want to leave you finally with this slide. And Deb summed it up earlier when she was introducing what we did and why we did it. But this is the actual quote that came out of Cooperative Extension's National Framework White Paper for Health and Wellness. And I think it's important for us to consider this and to actually, I'm going to read through it because I want you all to think about it. The extension model arose at a time when American agriculture was largely inefficient and only marginally productive. The consequences of the agricultural practices of the time were endangering our nation's economic, environmental, and personal health. A century later, American agriculture is without equal in its contributing food to a growing world population. We and others believe that this same system of extension can do for the nation's health what it did for American agriculture. Now, we're at a time in our history in this country where a lot of these ideas that were important for agriculture, economic, environmental, and personal health, are true now for the health of our nation. And we believe that we can do quite a bit to move our country forward and make some progress in that. So we're prepared, I think, to be a key player in that. And this report helps us position ourselves for that. So I'm going to direct you toward more information. And as I said, the report is very long. If you go to this website, you will find the summary, which is around 25 pages. So the summary itself is even long. But there is a lot more information about what we found and what the recommendations, findings, and opportunities were for us from this work. So I hope that you will check that out too. And now we can open it up for questions from all of you. I haven't been watching the chat board very carefully, but if you have a question for us, you can type it into the chat room now, and we will do our best to respond to questions. Thank you.
Well, yes, thanks, Paula and Deb. And everyone, if you have questions, please do type them in the chat box while people are getting their fingers limbered up. I might ask a question. In terms of family resource management, are there some, you had a list of programs or areas where we have some similar programming across the North Central region, and I'm guessing across the country. So are there natural places where we might start to do some joint evaluation efforts?
And I can respond a little bit to that, and Deb, please do chime in too. But, you know, you've got that slide up there now of some that were consistent from in several states in our part of the country, and I would guess that that's true across the country as well. But even looking beyond these programs, there are probably things that our resource management folks are involved in that we could evaluate together, more standardized, more parallel, which is what Battelle recommended. But we, as program leaders, can't really solve that for you. I think that's one of the reasons why we'd like to bring our specialists together to help create some ideas around how we can do a better job with this. You are the ones that are experts in knowing what the programs are about and what it might be consistent from one program to another that we could evaluate in a more consistent way and be able to tell a stronger story.
And I want to add just one thought to that. When you look at the list that's on your screen, you can see where there were similarities, but that doesn't mean that we were necessarily having the same objectives of those programs in all of those states so that we could aggregate the impact data. It was really interesting to see the little differences between states, which we value. I mean, it's great. All we're saying and we're hoping is that when we bring our specialists all together, we could get some consensus on a couple of things that we could identify as key priority. And remember when we did this now, this data collection is already a couple of years old. Right now, we have the health insurance literacy programming work that your group is working on, which has been going very well in many states and is probably at a point now where there would be some very good data to be aggregated. So there are some things that, you know, are naturally going to evolve, but we need to put those program leaders together, or those specialists together, or whatever your title are in various states, to do that. And then I would also add that there might also be a couple of smaller nuggets we could get at. For example, the terminology. And I know that's never easy to come up with consistent terminology, but maybe within some of those programs we could, and maybe it could be guided with a little bit more of a data-driven approach. Family resource management, if you use Google Analytics to see what are people all across the world Googling all the time. Are those the words they're using? And when we did that, we found that no, there are other words they're using that outpace this one by 10 or 15 times. Well, maybe we need to take advantage of some of that and have some discussions about the terminology that we use in our programming. So those are the kinds of things that we're so excited to be able to bring everyone together in April. And if those of you listening haven't heard about the April meeting, talk to your state program leader and ask whether or not your state will be able to participate if you can be there. And now I see there's a bunch of other little questions, so we better get to them.
And I was noticing, I think Barbara O'Neill asked the question on what were the top programs that we use in the region, and I pulled out the report to look it up because I don't remember all of that. But America Saves is one that's used in many states. Recovery After Disaster, and Who Gets Grandma's Yellow Pie Plate were ones that were the most used across the states. But I agree with Barbara in that we need to have common impact indicators, yes, even if the programs are different.
Yes.
That, as Deb was talking, the programs are going to be different. We're never going to have exactly the same program across state lines, or actually in Kansas, I would say across county lines. But to have common impact indicators is probably the best we can do, and probably the most appropriate thing we could do.
And the neat thing is what you're already doing in the chats here is what we have, as program leaders, started doing too. We're taking a look at what we use, what works best in our states, and it might be that there could be some consensus of coming together. Great. And if not, at the very least, having common impact indicators. So you guys are all echoing the kinds of thoughts we've had, and we believe we can make great progress by getting you all in the same room at the same time.
Well, and I just want to put a plug in for our next month's webinar, which is going to be February 24th, which is also Wednesday, which is a Wednesday, 11:30 to 12:30, and we are going to be led in a conversation by two of our colleagues about how we can move our evaluation efforts forward as a group. So that'll be Suzanne Bartholomew from Iowa State and Maria Pipidis from Delaware. So for everyone who's here today, and we will continue the conversation. What other questions do folks have for Deb and Paula about the report? Or, this is an opportunity. We have two program leaders here with us. I guess we could, if you have other questions as well, that are appropriate to our subject matter that you are curious about, I think, I guess one of the questions that I have is, how do you view, you mentioned the health extension work prominently, so how do you view that, and how do you view us moving into that in resource management? Do you see that primarily with health insurance literacy, or do you see other areas? What are your thoughts on that?
Of course, the health insurance area is a place where you all will probably take the leadership in that particular part of health extension. But family resources probably are cross-cutting in each one of these different areas. I hope that the conversations don't get too siloed as we're working around health extension. Sometimes we tend to stick in our own little subject matter areas and don't communicate well with each other, and it limits the work that we can do, I think. So, but I think that resources are a key component of each one of those parts of that orange part of the circle. I'd open it up to you as well. How do you think you can be involved in this work?
Well, as we're thinking about that, I might direct your attention to a question from Lisa and Marcia in Montana about state-by-state data, which recognizing that it would be in the North Central region, and I believe Montana is in the Western region, so you wouldn't necessarily have that. But so there's that question. And so some questions have come in. You want to take a look at those?
I'll start the state-by-state response to that question. Yes, we have state-by-state data, and that's the data that we submitted to the Battelle Institute as they were pulling together the impact of our programming. In some cases, the state data, we don't have enough to really tell a very good story. So it's part of the reason why we wanted to do a regional kind of study to be able to tell a stronger story.
We felt very confident that, and this kind of relates to the question down a little bit farther as to the studies that were, or the programs that were left off the table because there weren't impact reports. We had major discussions about this. And in a nutshell, I think I can sum it up by saying anyone can say, hey, we've got a great program. 200 people showed up. Everybody loved it. But that doesn't cut it with our decision makers. And so we spent an awful lot of time working on what we thought were some of the minimal criteria in that impact report that we would want to see beyond feel-good reactions. We had to, at the very least, be able to document that learning took place, and hopefully there was actually transfer or some kind of behavior change that is documented of some sort. So we really had long discussions about that, and that led us to some of the comments in the final report about the need to take a very close look at evaluation. I'll go back to Barbara's comment about common indicators and those sorts of things. That is an area of itself that needs attention. But if you go beyond that, we feel that we have tremendous opportunity to take some of those great programs we would hear about that didn't maybe quite make the cut. And if they are emerging programs that should be positioning us for our future, then we need to dig in and create proper evaluations for them and look at some multi-state opportunities to work on that particular program and grow it and get it to a level that we know will be considered impactful by our decision makers. Paula started out by saying economics isn't always the most important thing, and it's not. But at the same time, we have to remember, in order to grow into this health extension area or anything else in the future, we have to be able to convince our decision makers to fund those things. And so that's where we put a lot of our attention. And then I noticed the question about how did our directors and ECOP react to the report. My summary is extremely well. And, we were hesitant and nervous, just like any of you can imagine all the things that could have been thought of as negative. The vast majority found it to be extremely helpful, and they are working right now, ECOP is working right now with some of our national partners, and they are bringing in, not only through NIFA USDA, but other national partners to come in for a briefing to hear about this report and about positioning ourselves for the future. And I don't know, Paul, if you want to add anything about that meeting or if it's too early.
Yeah, I think it might be a little early to know what's going to result of that. But in other ways that we're using the information from this report, several states have already looked at the list of programs that came out of this research, and not just the ones that have impact with them now, impact data with them now, but the ones that are being developed and tested and have great potential for impact. And looking at that, helping make decisions on where we're going in the future. And then they will identify with other states that are also interested in those programs. And I think that will help us in the long run in being able to tell our story better and across state lines.
I just want to, Suzanne mentioned that for those of you who haven't read the report, those of us in the North Central region have had a chance probably within our states to at least read the summary, but that the family resource management programs were divided into financial literacy and advanced financial management. And I know personally for myself, it was good that the Battelle people, they weren't familiar with our programming. They weren't familiar with how we organize ourselves. I guess this gets in some ways back to the idea about consistent terminology and consistent program objectives. But, the way that they decided, or it was decided, to divide family resource management, or even some of the things that we might consider family resource management that ended up in a different program area. So I think, as we go forward and think about this, I imagine we all would have ideas about that. But it's a great start, and I think for me it was a very kind of a reality check about how someone who doesn't know what we do would organize it. And so I think we need to keep that in mind. And I guess, if we want it organized a different way, we need to share our message more widely so that we bring other people along to our way of thinking. But maybe that's not a useful activity. I don't know. So I don't know, Suzanne, if you want to clarify what if you were just sharing that as an FYI, or if you agree with the financial literacy, advanced financial management dichotomy or not. Let's have Lisa and Marcia ask a question about, has there been any flack about the method used to come up with the dollar value of our programming?
In years ago, when we were doing the FNEP studies, we involved economists, and the economists actually did the work for us. Of course, there's always discussion about all of that, but really there has not been that kind of flack as you might think there would be. And Deb, you want to talk about how you framed that with comparison to agriculture work and youth development?
Throughout this entire report, whenever Battelle would come back to something with us, we also would take time to say, well, how are they doing it in the other program areas, and particularly in agriculture? And, when they took a look at the Battelle report they did in agriculture a number of years ago, the methodology they used to determine dollars saved or whatever from production practices or variety trials and all whatever kind of things they have on the ag side, that's not an exact science either. And so we didn't feel that whatever was used in our report was any more controversial than anything that's ever been used in others. And then the best part is that it was developed and concluded. In all honesty, the Battelle people would have made far stronger statements than are in the report. We had to kind of calm them down a little bit because we felt like we would be inviting controversy. So we felt very comfortable and confident in what is in the report. And in all honesty, there is more the Battelle people would have put out if we would have been comfortable. And not that we told them what to do, don't think that for a minute, but because they didn't know our subject matter and how we operate, we just knew certain things we couldn't take credit for, so to speak, that it would be inappropriate. So we tried to keep things very much in a conservative light there.
Well, thanks for that perspective. Something you said made me think about, are there any plans either in the North Central region or another region for any sort of follow-up studies, or still absorbing all of this information and putting it into practice before it's time, or given the investment of the cost as well? But
well, one of the things that would be fascinating to do, we've talked about, and hoping a little bit of this will come about when the April meeting takes place, there are some things we can do to continue to log, collect, categorize the key programs being done in each of these subject matter areas. And hopefully when we bring the specialists together, perhaps that's something that they will want to do, or to examine then the evaluation methods. And I think what we would like to see is a couple of projects that would dig in and create better evaluation tools and better methods of aggregating some of the impacts. So those are really tough things that take lots of thinking, and if it does require funding, we have 12 states that hopefully could come together to to help fund such things. So, yeah, we've had a lot of dreams, I'd say.
And I would add to that that we've presented these data to the national group of program leaders, Family Consumer Sciences program leaders, and I wasn't able to be at that meeting, but from what I understand, there was a lot of discussion about how this information can be used or how we could continue the study across the country that might contribute even more.
I want to just comment on Suzanne's last item she put in the chat box. You certainly could reorganize these things in a number of ways. When you look at how all 12 states differ and try to find the common ground, it's certainly a challenge. So yes, when your groups get together, we absolutely would encourage your groups to go ahead and look at better ways to organize and better ways to title things. As I indicated, if you look at some of the data that we collected, I'm not sure family resource management is necessarily the best title. So we could have all sorts of discussions about those sorts of things, and that would be great to have that kind of really in-depth discussion when you're together. But at the same time, I think we were completely shocked at how different we operate. Not just what we call things, but we operate. For example, you would think it would be so simple to collect the number of FTEs that all states have in family resource management. We could not find a way, based on how every state does its financial operating, to even pull something simple like that together. So it was mind-boggling how different the states operate. And that involves a lot of time and energy and compromising. And so, it will be great to continue, but just keep in mind that once you all get together, I think, and I hope, you will get to see the beauty of how different we all are. I mean, there's beauty in that. But somehow we have to figure out a way to agree on various things.
Yeah, that last comment, what we're saying about state differences also applies to the counties. That's very true, and it does make it very challenging for us to even do state level reporting.
It does.
But we have to do better, or we're in jeopardy.
There's so much good stuff you guys are doing that we have got to get the message out. And if it means we haven't perfectly categorized things, it's okay. But we have to get the message out there, and we have to get our decision makers to be as excited about our impacts as we are.
And I just want to draw everyone's attention to a comment that Barbara O'Neill about E-Extension Fellowships. So we will, as information becomes available, I guess I would ask Barb to send it out to people. And then talking about that the FRM specialists across the country had annual meetings but no longer. And yes, I think that we have been having pre-conferences at AFCPE, which probably don't completely take the place of a specialist meeting. I mean, we get together, people with a family resource management, personal finance background get together at AFCPE, and we do professional development and things like that. Although we actually, interestingly, because Susan Shockey, our national program leader, has retired, we have sort of been talking about, well, maybe we could host a team huddle in this way and do it that way. So we are about out of time, but we are scheduled to go till 12:30. So if there are last questions that people would like to pose to Deb and Paula about the TEL study, about the information that they shared, this is kind of your last call for that. And I have put up a slide related to America Saves events starting next week. And so we hope that if you're available, you'll participate in those. And new huddles for conversation, not every minute pre-planned. Okay, yes, you're right. That's good. We need some time to talk.
You know, I see the comment about not having a USDA program, and I see where you're coming from, but that doesn't prevent us as the North Central region, for example, or an area such as your area from doing what it can do. And that is something that is definitely being discussed and worked on.
And I don't know if Deb or Paula, you can respond to Suzanne's question about program leaders' expectations for impact reports.
That too was all over the board. Oh my gosh. The 12 states could not be more different from having hardly anything to having very complicated systems.
And as discussions have happened over the years among the whole group of program leaders across the country, I think that's very true from state to state everywhere.
But again, we're saying, and we're really hoping, the power is when, you know, we're going to get these crews together, get this group together, and if there is a desire and there is a way to, within the group, create something that is feasible, then anyone who's doing family resource management can use. Why can't we go that route? We don't need the USDA to give us one official way. I think each group can take a look at what their states are doing, and you will see the variety across the states. And you'll pick the best from it, create something that you think is feasible for you to do within your unit. And that might be a little bit different than from the next one. So again, we're putting great value in our great minds getting together and coming up with some solutions here. Yes, Barbara, facilitate the discussion. Sure.
Well, I think you've given us a lot to think about, and this is maybe, I don't know, the third or fourth time I've heard a presentation about this report, but I take something new away every time, and we are so appreciative of both of you being here today with us, and this is sort of our relaunch of our Family Financial Security for All webinar series, and so we really thank you for being part of our relaunch, and invite everyone to join us in February when we talk about evaluation. And I know that you will, I imagine that Deb and Paula, you both entertain questions via email and things like that as well. So let's join, please sort of virtually join me in thanking them for being here. And if there aren't any other questions, I think we will sign off now. Go ahead and keep typing, and then if there's something that comes in, we'll can respond to it.
And thank you all for taking time to participate in the webinar. I know there's a whole lot more we could talk about. And speaking for Deb and myself, I believe we'd both be happy to respond to questions or tell you more about the study. And I'm guessing that the other program leaders in the North Central region would be equally willing.
And I'd also throw out, because I see someone just wrote there from Texas, nothing would make us happier than to see some of the other states share how they are addressing this. And we haven't had a chance to share our message thoroughly with other regions, just a little bit at a couple national meetings. So, yeah, we hope this will grow into discussion across the nation. Thank you.
We'll wrap up now, and everybody have a good rest of your day and a good rest of the week.